Hi guys, I'm Dr. Peter and welcome to another episode of Before and Beyond. Today I've got a case, and it's a simple case, but it's also a quite important case. I've got a patient here who presented to the clinic with a lot of buildup of what we call calculus. So it's actually all these things that you see in the photo here. And when I see this, my first thought is thinking, how did this happen? How did we get to this point? And sometimes it's just a matter of not seeing the dentist for a long time, but also it's also a matter of your hygiene habits. And what's really important with these cases is that we want to get down to the bottom of why we haven't been looking after our teeth. But then after that, we want to get things really healthy. So I've got a picture on the side here to show you what basically a healthy tooth and a healthy gum looks like. And this one here on the side is what happens in a situation like this. So what's happening is this little brown part here is actually all this buildup around the teeth and the gums. And the problem with this is if it stays there long enough, it will cause gum inflammation, which you'll often notice with bleeding. But if it's left really long enough, what will happen is it will actually start causing the bone to recede. So the bone starts going down, and that becomes really problematic. So in a patient like this, what we really want to do is we want to start with a really thorough deep clean. Usually it's under anesthetic because we have to really get under the gums. So we numb up one side of the face, we go a real deep clean, get everything really nice and healthy, and then after a week or two, we do the other side. And you'll be surprised by how healthy the gums will just rebound. But what's important is doing that and then teaching our patients about oral hygiene, trying to improve things. And then another really important part of the treatment like this, another recall in probably about 3 or 6 months, because we just want to keep going uphill. We don't want to come back to a situation like this. Another thing is what we'll often see in x-rays for a patient like this are these little bumps on the sides of the teeth. So your teeth actually should have a nice smooth contour, not these little extra bumps on the teeth. What this is, if we go back, is actually these bits of calculus on the teeth. So when we do these deep cleans, what we're doing is actually going under the gums and cleaning all of this off. And that's why we usually numb you up. So yeah, really important with patients like this that we get to the root cause, how we ended up like this. And then after that, it's really thorough cleans and then a good recall and teaching some oral hygiene habits. So simple case, but also something that a lot of people end up having a bit of trouble with. And yeah, that's the case for today. Anyway, thanks guys. Bye.